Welcome back to Primetime News.
And a special welcome once again to our viewers on onespotmedia.com.
Now, is the country on the brink of another national health crisis? The question many have been asking as medical facilities, both private and public, have been overwhelmed with cases of respiratory illnesses.
Now, already alternative arrangements have had to be made at the Bustamante Children's Hospital, where patients under 12 are now being treated at the University Hospital of the West Indies.
Now, while we've been receiving reports of many employees being unable to show up for work due to illness, what's really causing it?
And to answer that, we have joining us medical doctor and public health specialist, Dr. Orville Nemhard. Thank you so much for joining us, Dr. Nemhard.
My pleasure, General.
Okay, so we're just going to get straight to it. We're hearing a lot of reports about persons complaining about respiratory illnesses, flu-like symptoms, yeah? What can you say? What have you been seeing?
Well, over the last 2 or so weeks, we've seen an increase in the number of persons presenting in what would be officially classified as influenza-like illness, which means they're having a fever, plus a cough or a sore throat, and sometimes additional symptoms such as headache, muscle pains, maybe even vomiting and diarrhea. And we're seeing it largely in the younger age groups, the children, the primary school and preschool, the young adults who are out at work, and in the parents of the children who very often say that they got ill from the child coming home with the illness.
Now, you're seeing more and more schools and institutions going back to face-to-face activity. Of course, persons are now more and more outside. Is this linked to dust or pollen increased activity? What would you say?
The suggestion is that it is very likely a viral illness. The fever and the sort of debilitation, the malaise that we see with persons who come in would not suggest that this is just pollen or seasonal related in that regard. It is somewhat out of season for flu-like illness in the sense that here we are in April when it should be the tail end of the season, and we're seeing what appears to be something of a spike.
Doc, I have been asking for data in terms of the numbers of persons who have been experiencing these symptoms. Based on your own practice, can you give us an example of how many persons you have been seeing per day? Do you have that sort of numbers?
Off the top of my head, no. But what I would say is that it's a significant proportion of the persons who come in that are complaining of some sort of respiratory illness. And as I said, particularly that younger age group or that early, what I'd call early adult age group that's out at work.
Well, Doc, while we figure out what exactly is happening, what can persons do or what precautions can persons take to ensure that they safeguard their own health?
Well, in keeping with the flu-like nature, the presumption that it is a viral infection, then the precautions go across the board. So we have learned from COVID to distance, to do things like cover our cough in the sense that we cough into our sleeves or elbows rather than into our hands. We minimize contact with persons. The precautions are universal in that regard. And the treatment also is equally universal. You manage the symptoms, the aches, the pains, the fever, the potential dehydration, particularly in the kids who are running fairly high fevers.
All right. Thank you so much, Dr. Nemhard. So many questions, but we have run out of time. Another